Hello, my name is Darian. I'm a midwife in training, and this is an educational video comparing signs that breast/chest feeding is going well versus signs that there may be a problem. During pregnancy and up until a few days after birth, the body produces colostrum in the breast/chest. This colostrum then transitions into a transitional milk and more mature milk at around a couple of days to a couple of weeks after birth. And colostrum is thick and sticky. I kind of look at it like a concentrated milk. It is sometimes yellow, well, usually yellow, but sometimes can be clear or white. And this colostrum is not only milk for your baby, but it's also medicine, just like your breast/chest milk. So don't let anyone tell you your milk isn't in. Your milk is in. It's just colostrum at first. And it often comes in small amounts. But don't worry, because that small amounts is just as what your baby needs. Your body will produce what your baby needs. So this here disc represents about how much colostrum or milk the baby needs on day 1 after birth. And this is about 6 milliliters, and this also represents the color of the stool. It's usually dark, very sticky and thick meconium, the stool. And around day 3, it's about this size as far as how much milk or breast milk a baby needs. And this is about 26 milliliters. And of course, this color represents the color of the stool around day 3. And how it's transitioning from that really dark color to a green. And then around day 10, 60 milliliters is about how much milk a baby needs around day 10. And it is usually the stool has transitioned from, again, that dark meconium color, that green thicky color, to more of this yellow color. So how do we know your baby is getting enough milk? Let's talk about it. What are some signs that your baby is well fed? Well, let's think about the pee and poop diapers. That can give us a really good indication or predictor of whether or not the baby is being fed adequately. Some organizations like IBCLC suggest signs of effective breastfeeding or chest feeding include 3 stools per day after day 1 and at least 6 wet stools after day 4. And studies have shown that the first day of yellow stool was a significant predictor of weight loss. Earlier, the baby's stool is turning yellow, the less weight was lost. So like the Academy of Breastfeeding Medicine considers the earlier the transition from that dark stool to the yellow stool is a good sign of hydration and adequate breastfeeding/chest feeding. And also if there's about 3 or 4 stools by day 4 after birth from the baby. So basically, good stool output is a good indicator of adequate breast/chest feeding. Now, if there was frequent feedings without many stools, then that is definitely considered a red flag when it comes to breast/chest feeding. For example, less than 4 poo diapers by day 4 is considered a red flag. Now, there are also other indicators of good milk intake. For example, the alertness of the baby, the responsiveness of baby, and again, the growth, for example, the increase in head circumference and in length. Your baby should still be receiving care by a provider right after birth, and they should be getting weighed. Their weight and their growth is monitored. Babies usually lose about 5 to 7% of weight after birth, and that lowest weight being recorded at around day 3 or 4. So again, baby should growth should be, monitored and tracked by their provider. So it's very important that babies are still seeing a pediatrician or your midwife after birth. So again, some behavioral signs like responsiveness. Is your baby, happy and seems, content after feedings, or red flags showing like baby's looking lethargic and doesn't tend to wake up, or is really fussy when is woken up. And considering how long your baby is feeding for, like the feeding patterns, how often throughout the day the baby is feeding for. If the baby is only feeding 4 or 5 times at the day, That's really unusual compared to average babies that are feeding 8 to 12 times a day. And not to say that babies should just be feeding every 2 hours. Your baby should be feeding on demand, which means babies should be fed when they look like they're hungry. Now, if it has gone past 2 hours without a feeding, then that is a good indicator to wake the baby up to feed them. And not only about patterns and frequencies, but what is the environment like, and what is the comfort level of parent and baby? For example, what is the positioning like? Is the breast slash chest feeding person comfortable? How are they, holding the baby? How is the latch? Is the latch comfortable? Is it comfortable, or is the latch painful? Painful latch is definitely not good, and it should be addressed immediately. And also, do you see signs that the baby is swallowing and suckling? Like, do you see the baby like suckle and swallow as you are breast slash chest feeding? A poor latch can prevent a baby from getting enough milk. So, just to summarize, some good predictors or indicators that your baby is getting enough milk is the stools and the pee diapers, the behaviors of the newborn slash infant, like if they're alert or responsive, feeling happy and looking content after feedings, and just keep in mind how long they're feeding for, and what does those behaviors look like, as far as, do you see a suck and a swallow, is the latch appropriate, and things like that. Thank you for listening. I hope this was very informative, and I will drop some resources in the description.